The medical malpractice case, general standard of care issue. In preparation for a laminectomy or spine operation, the plaintiff, patient Elliot Schaefer, was given anesthesia and placed face down on the operating table. Following common practice, the defendant doctor, Theodore King, taped the patient's shoulders to the operating table to make the surgical incision easier and to allow the path of the X-ray to be clear. After the operation, plaintiff suffered numbness and weakness in his left arm, an area outside of where surgery was performed. Plaintiff alleges, 1, that the defendant placed excess tension on the arms and nerves of the upper extremity during the taping procedure, causing a brachial plexus injury to the network of nerves that conduct signals from the spinal cord, and 2, the defendant's failure to ensure that there was not excess tension fell below the standard of care. Plaintiff wants to introduce evidence that if there had been the use of evoked potential monitoring during the pre-surgery and surgery procedure, the injury could have been avoided. Defendant has filed a motion in limine under Evidence Code Section 352 to exclude any questions regarding this procedure during the trial, asserting that the general standard of care does not require this procedure, and reference to it would create substantial danger of undue prejudice, confuse the issues, and mislead the jury. Outside the presence of the jury, Dr. Neil Taylor, plaintiff's expert, and Dr. Tess Wilkinson, defendant's expert, give juxtaposed expert testimony on the motion. The juxtaposed testimony sharply defines the differences in the experts' opinions on the standard of care.
Dr. Taylor, is it a common practice to tape the patient's shoulders with broad straps of adhesive tape to the sides of the operating table before performing a laminectomy?
Yes.
How is this accomplished?
Well, the surgeon or someone acting under the surgeon's supervision pushes on the shoulders and straps the tape to the operating table.
Is it true that excess tension placed on the arms and nerves of the upper extremity during this procedure can cause a brachial plexus injury?
Yes.
Dr. Wilkinson, do you agree with that?
Yes, if there's excessive pressure or tension that's placed on the shoulders when the strapping's done, it can cause an injury. That's why it's particularly important that you use equal pressure when you're strapping the patient so that both sides, both shoulders have the same pressure and tension put on them. One way you can tell that that's done is that the shoulders are pretty much even. What you don't want is one shoulder well above the other one.
Dr. Taylor, how does the surgeon determine how much pressure is being put on the shoulder?
Well, it's a feel. The surgeon palpates the shoulders and sort of eyeballs it, and then feels how tight the tape is. The surgeon avoids the problem of uneven shoulders by paying careful attention to the tension of the tape and applying the same amount of pressure to one side as to the other so as to avoid the possibility of injury.
Well, was this the procedure that was used by the defendant, Dr. King?
Yes, it was.
Dr. Wilkinson, do you agree with Dr. Taylor that this is a common procedure when taping the shoulders for avoiding excess tension and a possible brachial plexus injury?
Yes, as the doctor indicated, that's how many doctors would do it, yes.
Well, did Dr. King use any type of objective measure, any kind of measuring device, tool, instrument, or anything else to determine how much pressure is placed on the shoulders, such as evoked potential monitoring?
And by evoked potential monitoring, we often call that EPM for short. No, I don't believe that Dr. King did use EPM in this case.
Well, doctor, do you use any objective measuring device to determine whether there's excess tension on the shoulders?
I do. That's partly because of where I practice, which is at USC Medical Center. But I do, yes.
How about you, Dr. Taylor? Do you use evoked potential monitoring?
Yes, in all of my laminectomy procedures.
Do you agree, doctor, that the failure to ensure there's not excess tension during the procedure of taping the shoulders is below the standard of care?
Oh, yes.
Dr. Wilkinson?
Yes.
Dr. Taylor, do you believe that the doctor performing the procedure without the use of evoked potential monitoring in and of itself is below the standard of care?
Yes, I do. If the electronic monitoring is set up and going before the surgery, and if there's too much tension, then we're going to see that before the surgery even begins. And so the surgeon would be able to readjust the tension and prevent injury.
Thank you, doctor. No further questions.
The defense attorney questions its expert, Dr. Wilkinson, to refute the plaintiff expert's assertion that failure to use electronic monitoring is below the general standard of care.
Dr. Wilkinson, do you agree with Dr. Taylor that performing a laminectomy without the use of evoked potential monitoring in and of itself is below the standard of care?
No, not at all. In fact, using EPM is not within the standard of care. Many doctors, including myself, don't feel that it's necessary. For one thing, it adds time to the surgery. The patient's under anesthesia for a much longer period of time while you're putting in the needles for purposes of monitoring the muscle. Another thing is that to use the EPM adds a significant cost to the operation. Most doctors, or at least many doctors, and myself included, believe that there's enough margin of error when it comes to being able to strap down the shoulders that using the monitoring is simply not necessary. And I indicated earlier, I believe I answered other counsel's question over there, I happen to use it, not because I think it's necessary or within the standard of care, but I happen to practice at USC Medical Center, and at that particular medical facility, the monitor is continually in operation.
Are you saying that the cost of evoked potential monitoring, or EPM, is a consideration regarding whether the general standard of care requires its use or not?
Well, to some extent, yeah, that's a reality. In other words, I mean, doctors are always looking at the cost of procedures versus the risk if you don't use the maximum protection that you can. But again, with this type of operation, it simply was not required for purposes of being within the standard of care. Now, if the operation had been a longer operation, then the risk of brachial plexus injury increases. And if it were a longer operation, then it could be possible that using the EPM would be within the standard of care. But this operation was a short operation.
Now, you just heard Dr. Taylor testify that with electronic monitoring, the surgeon would be able to readjust the tension to prevent damage.
Well, actually, I mean, I did hear him say that, but the problem with that is that readjusting the tension, you're assuming that that's coming from the, again, from the brachial plexus. The brachial plexus is a very complex structure in the body, and when there is tension, you don't know whether it's coming from the brachial plexus or whether it's coming from some other source. It could be coming from a nerve root, for example, in the neck.
Thank you, Doctor.